I'm here representing the Foundation for Health Coverage Education. We've put together a very high-tech, low-cost solution to the uninsured problems in the United States. The problem we saw is that a lot of the uninsured are eligible for programs and they're not aware. And so what we did is put the entire United States healthcare system online. Over 3 million Americans have used it. Through the power of technology, FHCE enables people who need health care obtain it. There's 16.9 million Americans who are eligible for publicly funded programs and not signed up. They're using the emergency room as their primary care. They go in the emergency room, they get taken care of, and then they leave. And the emergency room cannot collect because they're not there and they don't have the money to pay anyway. With a mission to provide simplified public and private health insurance eligibility information, the FHCE enables us as a nation to know and control our costs, prevent waste, fraud, and abuse, and allocate the total cost of health care properly and accurately. And we do this because we do eligibility at point of care. So when someone comes into the hospital, it takes 2 minutes. 2 minutes. The whole United States is online, all 50 states and the District of Columbia. The administrator asks the questions. They see what they're eligible for. It can be confirmed online, and then the hospital or doctor gets reimbursed. With point-of-care reimbursement and point-of-care eligibility, we empower the individual to understand that they have coverage if they're eligible. They no longer need to go to the emergency room for everything. All they simply need to do is show up at a doctor's office or a clinic. It takes 2 minutes to figure out. Once we collect all that data, for the very first time in American history, we're going to be able to budget our health care costs. And we'll lower immediately the uninsured by 17 million people. And if you think about it, and one of the biggest problems with what, as I see it, with healthcare reform is that they've confused health insurance with health care. Mm-hmm. And so all of the programs that are public programs are really prepaid health care, right? It's not insurance. You're not evaluating risk. You're not trying to do anything except for give access to health care for the safety net, which we need. We all believe in that. But the thing is, they've created this huge barrier of entry for let's say, a single woman with two children at home to have to go down there and get signed up, and then they can never do it in one try, and then she has to go back, but she's working, and now it's a huge problem. Why are we making her go through that?